Hi, I'm James Shillinglaw. I'm here with Lori Calavan, who is the Senior Medical Consultant for Allianz, it is the travel insurance company. And we're going to find out what Lori does for Allianz and what she is going to recommend to you and your clients when working with travel insurance companies and dealing with medical situations. And you'll find out all about that and more on Insider Travel Report. Now, Lori, first of all, tell us a little bit about your job, exactly what you do.
Thank you for having us. I'm actually one of the senior medical consultants. So when a person has a travel insurance policy with Allianz, if they are injured in a country overseas or have an accident anywhere, or even within the United States, they contact Allianz through a nice, handy Travel Smart app on their phone, and they can let our team know that there's something wrong. So we have a team of physician assistants, medical doctors, registered nurses, and case managers that can actually all work together to obtain the medical information.
Right.
And then we get all of the pertinent laboratory findings, vital signs, every medical reports, imaging to determine what's going on with the patient.
You're getting that information from the doctor or hospital abroad, right?
We're either getting it from the treating doctor itself, the hospital, or sometimes even from the patient's family members, depending on the remote location of the patient.
Now, what was a typical situation? What would you recommend? I'm abroad. I suddenly get sick. I come down with, I don't know, a parasite or something, or I have an accident, and they decide that I'm going to be put in a hospital or go to a doctor. Should I immediately contact Allianz and let them know what's going on?
Absolutely, because it could be the simplest thing, but complications happen no matter where you are, and you could have something that starts off very small that could easily and quickly decompensate. So you want to let us know so we can make sure that we're reviewing everything to make sure, number one, the care is appropriate and if the facility is able to treat you. Because if they don't have the necessary or the necessities to, treat the condition that you have, you might need to be evacuated to a hospital or a facility that has the special capabilities that you need.
Yeah. Well, I used to have a reporter work with me who had a collapsed lung, and he did have Medevac insurance, and so he could get Medevac from Panama back to Miami, and that was a wonderful thing to have. Would you recommend that people look into Medevac insurance?
I would absolutely. I would not travel myself without travel insurance, and a policy, or depending on, there's a range of policies that you have, but if you have a condition like that, a collapsed lung, you can't just travel, because if your lung is collapsed while you go up in the air, that air expands, and it can collapse your lung to the point where it presses on your heart and someone could die. Right. So you want to make sure that you're at a facility that knows that they need to put a tube in, and then you could be transported with a tube or what have you, but you have to make sure that the patient is safe to go. So travel insurance is absolutely a necessity that I would have, because an evacuation like you're speaking of could cost up to $100,000.
Now, do you have an idea, based on your experience in certain countries, you're pretty sure that the medical care is great and it's okay to be there and be treated there, sometimes better, who knows, versus some countries where it might not be so good, right?
Yes, and Allianz actually has a huge global network that they're able to look at different hospitals and has connections to see which facilities they have. Say if you have someone that needs a cardiac issue or has a cardiac issue and needs interventional cardiology versus neurosurgery or what have you. There's a huge network that they have that tells you what facilities are where.
Yeah, so you're aware of that. I guess the other question is, travel advisors, who are our audience and who are the people selling travel insurance to their customers, they're not doctors. They're not nurses. They're not, they don't have a sense. But what would you tell them to tell their clients about coverages and what they should know?
So when you buy a policy with us, we have 24/7 medical coverage. So that means someone from the medical team, that I'm a part of, we're trained in emergency medicine, critical care, aeromedicine, hyperbaric medicine, and we know what needs to be done for a traveler in different conditions or different specialties. So we have their back 24/7, and if something's going wrong in a remote country or what have you, we'll be able to follow and determine whether your care is appropriate and whether you need to be evacuated or not. We're not just relying on the facilities in the country where you are, because we don't necessarily know that their training or their capabilities are to our standards, and we want to make sure our patients are safe and get the care they deserve.
Anything else that travel advisors should know to tell their clients about getting travel insurance and working with your company to make sure that they're safe and sound when abroad?
I would say just get it the sooner the better, so you always have it and always protect yourself, and make sure that no matter what policy you have, you buy it early. And you don't want to do something or think about it after the fact when you're already injured,
Yeah, I'm sure you've seen a lot of cases, unfortunately, with, we all unfortunately get sick. I know I have over the years, and I may not have had the best coverage, unfortunately, and I just sort of gutted it out. But this way, you can make sure your clients are safe and sound, they have the right coverage, they have access to the team at Allianz that can help them. Thank you so much for taking the time about this. It's a great topic. It's also a way to protect your clients, also get some commission on it, and it's going to be a great service for your customers.
Thank you. Take care.
I'm James Shillinglaw, and this is Insider Travel Report.